We're extremely excited to bring to you the Eat Right India initiative of FSSAI, adopted by Herbalife Nutrition. Herbalife is all committed to make the country healthy and safe in their series of this initiative. Part 2, also acknowledging our broadcasting partners, the Mitro app, Daily Hunt, Union TV. And together we'd like to extend a fervent welcome to all of you, a happy new year to all of you on this session. According to FSSAI and Herbalife, all good health starts with diet and digestion. Accordingly, one of the most important things that we can do for our health every day, friends, is to eat wisely, as food is a powerful medicine. Today, I'm pleased to introduce very eminent personalities. But before that, our eminent chief guest for the special program is Ms. Inoshi Sharma, Director, Social and Behavioral Change at the Food Fortification Resource Center. She's a civil servant and officer of the IRS. I'd like to invite Inoshi ma'am to give the keynote, please.
Thank you so much, Nidhi ji. It's such a pleasure to be here, and I must congratulate Herbalife for really adopting the Eat Right initiatives and really putting it forward. And meetings and webinars like these are actually wonderful ways in which, through interactions and dialogues, we can kind of improve on our outreach, and also in terms of the implementation and outreach that we are having. So, now that you've talked about the Eat Right initiative, I'll just take a couple of minutes to sort of, talk about what is it really that we mean by the Eat Right India. So the Food Safety Standards Authority of India, of course, is the apex body in the country, which looks after the regulatory aspects, setting up standards for food products, and also ensuring that, the lab network where foods are tested are in place. But what we've also realized in the past 3-4 years is that having, a system for regulation, for testing is by itself not sufficient. What is really important is to also create an awareness both among the consumers as well as the food business sector regarding the importance of safe and nourishing food. And why is it so important that in today's world, we also ensure that it is produced in an environmentally sustainable manner, and also encompasses some of our traditional food culture. Now, why that becomes important is because we've all heard about Ayurveda. We've all heard about, our grandmothers talking about certain timings and certain ways in which food should be eaten, a certain combination with which it should be eaten. But in this fast-paced life that we have, many times because of paucity of time, sometimes it could be because we don't have access to nutritive food. Sometimes it can be an issue of affordability also, that we, forget about the kind of food that we are really having. We just eat so that we satiate our hunger, but we don't realize, is it providing us with the adequate nutrients that our body needs? And therefore, we thought that, considering a country which is the second most populous in the world, what is it that we want our citizens to be conscious about? We need to make sure people in India are having food which is locally produced, which is seasonally available, and which is made at home using traditional wisdom, with the traditional spices that we had, the oils that we have. Enjoy the meal, chew it properly, make sure our digestion is properly done. Now, why that becomes very important is because, one, if food is prepared safely, you don't end up having foodborne illnesses. In a country like India, it's amazing. We have almost 100 million cases of foodborne illnesses. And that leads to almost $12 billion in terms of GDP, in terms of, people spending money. Then when you do end up eating food, you realize if you're not getting the proper nutrition, you realize that actually you may end up having micronutrient deficiencies. A lot of people from very good families also don't have proper hemoglobin levels. They may have deficiency in vitamin D, A, B12. It's become so common that you are having pills or having sachets. Now, why that happens again is because we are not having proper food. It's amazing. The NFHS 5 data, which has recently come out, also shows a lot of states. So almost half of the population, which is women, and among women, at least 50%, more than that, and children are anemic. Also, there's a lot of food waste which is happening. We don't even realize it at home. Sometimes a little bit of sabzi or dal or anything is left. sometimes people do throw it away. They won't think about recycling it or sharing it. So that's another initiative that we have to think about, of how we can, make sure that the food that we have does not get wasted. So there are 5 broad key actions which come under the Eat Right initiative, and they can all be clubbed into 3 broad pillars. The first pillar is Eat Safe, which means food should be prepared in a safe and hygienic condition. It should not have adulterants, and it is not leading to any foodborne illnesses. Second, eat healthy. Healthy means you are having proper micronutrients. So have fortified foods. Fortified foods are available in our country: milk, oil, salt, rice, and wheat. And in fact, recently, we've also urged the food businesses to adopt fortification in processed foods, such as breakfast cereals, juices, and bread and bakery wares. And eat healthy also means you're having local seasonal foods. A lot of people, at least like I'm from North India, even in summers, they'll have matar and gobi. And in winters, they'll look for bhindi. Why do you do that? Have the fruit and the vegetable which is off the season. And the last is eating sustainable. Sustainable means you eat something which is good for your planet. So obviously it's local and seasonal because the carbon footprint is not there, but also making sure that, for the food businesses, you're not reusing the oil. At an individual level, you are not using plastic. You reduce the consumption of or wastage of water. Those are some of the things. And of course, then when you think about these 3 pillars, under each pillar, under Eat Right initiative, you can have a number of programs. So for instance, currently we are working on the front of the pack labeling, which should hopefully see the light this year, where we want people to be sensitive about a high content of fat, salt, or sugar in a particular product. We've already, come down to 2% trans fat in a particular product from the 1st of January. And we are also big time into training of food handlers. So we have a program called FOSTAC. And what we do is we urge the food businesses that whoever is handling food in your units should be properly trained. It's just a 4-hour training session in which training is provided. Then we have a lot of certification programs where we are urging people with even small outlets. It could be a dhaba, it could be a street vendor, it could be a huge hotel, it could be a restaurant, fancy outlet. All of them can get certification in hygiene rating, which again means that the people who are handling food are properly trained and safety and hygiene protocols are maintained. And then, of course, a big chunk of Eat Right is on the IEC, where we want people to be aware about why is it important to reduce the amount of salt, sugar, and fat in their food, how they can in every day adopt programs or menus which are good for health. So it's like a bouquet of programs. And of course, when we are talking about the FPOs, we have, of course, FPOs like, for instance, Herbalife, which have actually adopted a lot of our programs, such as the Eat Right Campus, where we make sure that not just the consumers for whom we are making our products, but even our employees, when they come and work, they work in an environment where, healthy food is provided. There is a lot of IEC display to adopt those things in our personal lives. So Eat Right, therefore, provides you with a bouquet of a number of initiatives. So I just wanted to, sort of share in brief what this program is about. There are endless programs that we have, but I'll stop here because I believe we've got a wonderful panel discussion and I'd like to hear that and then maybe, take on some questions. So thank you so much.
Thank you so much for those inspiring words. As Mark Hughes, founder of Herbalife, dreamed of a future brilliant beyond compare, his vision was aligned with improving people's lives. And midway through the pandemic, friends, this is the perfect time to initiate a discussion today on Eat Right India, as we stand at an inflection point today. I welcome our esteemed guests at the panel, Mr. Ajay Khanna, Senior Vice President, India Country Head, Herbalife Nutrition. Thank you for joining us, sir. Dr. Pramod Garg, Executive Director, Translational Health Science and Technology Institute, THSTI, Faridabad, and formerly from AIIMS. Many thanks for joining us, sir, and for your time. Dr. Iram Rao, from FSSAI, also the prestigious Delhi University. Thank you, ma'am, for your time. You have been handling and supervising content at the Food Safety and Standard Authority of India. Then we have from Gujarat, our Deputy Food Commissioner, Food and Drug Control Administration, C.H. Gohil, working with FDCA since 1981. Many thanks for joining us, sir. Namaste. And of course, we're very happy to be joined by Srimati Leelavati ji, Food Commissioner of Karnataka. Many thanks for your time, ma'am, and thank you for joining us today. I'll begin with you, Mr. Khanna. I would like to ask you in the beginning, what and why immunity is the best defense, and how does one fuel it? Sir.
Thank you, Nidhi, and thank you for the question. And first of all, wish you all a very happy New Year. Well, it's an important question because, you know, immunity is a complex biological process, and that is either innate or acquired. We all recognize that inner nutrition and wellness has a strong role to play to build the building the and enhancing the immunity. You know, while the mainstream discussion has always been around nutrients and their impact on the body, we are now looking at multifaceted, multilateral approach to building, you know, immunity. And there are many lifestyle factors that impact our immunity. We all know that healthy lifestyle and good nutrition are key. And you also heard Inoshi ma'am talking about healthy eating, you know, eat healthy. But we also require, you know, educational resources and programs such as the Eat Right movement to know how to use nutrition to our best advantage. You know, Nidhi ma'am, one of the biggest questions we want to answer is around bioavailability. How can we get value out of any food? This means that we need to ensure quality of our food cycle from the start, you know, what we call it seed to feed. We do need to examine the entire food cycle to ensure availability of all food groups are sustainability produced or cropped, and to support immunity. I mean, that's and which is very critical for the public health.
This is the right time to initiate such a discussion, as you rightly said. And I'd like to go to our next panelist, Dr. Garg. I think nutrition is very related to your insights as well, as the world is today sitting on a mountain of unprecedented health. Tell us something in your words as a doctor, and such an eminent one at that from AIIMS. I'd like to ask you, what is your definition of malnutrition, overnutrition, undernutrition, sir?
Thank you, Nidhi, for this very important question. So malnutrition is either undernutrition, where someone is not fed properly, or overnutrition, where he is fed or she is fed more than what the person actually requires. So, and both are not good for your health. So undernutrition is something where you don't take enough calories, or you don't take enough proteins, or as Madam Sharma was saying, you don't take enough micronutrients, be it vitamins or minerals. And overnutrition is where you take more calories than what is required. And as we all know, it results in obesity, and obesity itself, by itself, may be now classified as a disease, rather than just saying that, you know, someone is obese, so associated with many other problems. But by itself also, many people would categorize it as a disease. So undernutrition, where you have protein energy malnutrition, or you have protein malnutrition, and overnutrition leading to obesity, I think both are major problems and have an impact on immune function, as just been discussed.
Absolutely, sir. Mr. Gohil, sir, आपसे जानना चाहूंगी मैं, nutrition is not just plain nutrition, as now Dr. Garg said. There is a whole new science to it, like AI, the new buzz approach. What is your take on the field, sir, if you talk about Gujarat?
Yes, thank you, ma'am. As Gujarat is working with the ground state of all the human being, so for taking the care of the nutrition at each level, as per the instructions and regulations developed by the FSSAI, we are following that on the field staff. So we can say that in MDM, ICDS, and BISEC medium, we are providing the training to the concerned persons for the getting the proper nutrition. So we are doing at the field level. And as the Dr. Kosia is going to join, but due to the one international event, Vibrant Gujarat 2022, he is busy with some urgent meeting, so he couldn't able to. So he passed the message to this meeting for good success.
Thank you so much. Yes, we are missing with Dr. Koshia, but we are so happy to have you here with us. Leelavati ma'am, if I may ask you as a Food Commissioner of Karnataka, how does India's Eat Right campaign and Fit India movement help address India's malnutrition, ma'am?
As far as Karnataka is concerned, in general, actually in India, this Eat Right movement definitely will create awareness among all the stakeholders, that may be government, citizens, and everybody. Like they'll come to know what they have to eat, and regarding the hygiene also, hygiene of the kitchen, everything. Here in Karnataka, actually, regarding this Eat Right, even in Anganwadis, schools also, we are taking a lot of initiatives. Even in Anganwadi, government is providing nutrition food for the children, and regularly checkup also has been done. As well as even in government schools also, where we are providing midday meals for the children, there also regarding Eat Right, we are creating a lot of awareness to the schools. And as far as kitchen is concerned, how the kitchen has to be maintained cleanly and how nutrition is very essential. And our Chief Secretary himself every month reviews Anganwadi children's progress as far as nutrition is concerned. So this way we are creating a lot of awareness in Karnataka for all the people. And now I feel this is one of my suggestions, that if we introduce regarding this nutrition in the schools, if the children come to know, maybe that way we will be building a very healthy society. So, and we also should create awareness regarding malnutrition and as well as overnutrition to the children from the school level itself. And that will be better, and it will create a healthy society.
Absolutely. And in that regard and context, I think the Eat Right Schools is a fantastic program where nutrition can be the buzzword. Dr. Iram Rao, I'd like to ask you now, under the Eat Right program, how can we train street food vendors or preserve the rich culinary heritage of India by using healthy and sustainable diet, ma'am?
Thank you so much. And I think I have been listening to all the experts and their wonderful suggestions. I think it's very important to kind of provide them first with some basic training, which FSSAI has already started that. And I think what we are all talking about over here is bringing about a behavioral change. What I understand is that everything in this world today is demand driven. So if we also bring out this particular change and empower and educate the consumers to start demanding for healthy and nutritious food, I'm sure the supplier, the street food vendor, would be compelled to make those particular changes. Yes, with that, we have to also provide them with the hands-on training of good hygiene practices, making them aware of what are the key things which they should adopt to make the food not only safe, but also healthy. How should they keep and store their food? What can they do with the disposable form of cutlery, etc.? And I think with the pandemic, all of us have learned one thing very clearly, that hand hygiene, which we were talking about it all this while, we all have at least cultivated one particular habit, if not everybody, most of us, to do not touch your food without washing your hands, least bit use a sanitizer. So if all of this has also been transcended to the street food vendors, I'm sure this is going to make a gradual, but certainly a certain change in the times to come.
Absolutely. A certain shift will happen, and are taking it forward with the Eat Right India and all such initiatives at FSSAI will help, certainly. Inoshi ma'am, my question to you now is, you mentioned salt. What other areas do you feel FSSAI has to work on to make people aware?
So see, when you talk about salt, actually the availability of salt in the market, in the open market as of now, is a little restricted. One, of course, because about the awareness of the benefits, and second, because there's no demand, therefore the availability. So we have about, say, 8 players in the market who are providing double fortified salt, and they mostly are providing it into the states through the PDS MDM programs. And in states where they are providing salt in PDS, they are doing that. So I recently came back from my visit from J&K and from Haryana, and I got to know that in all the programs over there, they are providing double fortified salt. So we are working, in fact, because of the COVID situation and the lockdowns, we really couldn't, do a big sort of a campaign on this. But in the next few months, we will, really work on promoting double fortified salt. But if I were to just look at salt, I mean, because, just salt, the consumption of salt per se in our country, vis-a-vis, the global average is almost double or even more than that. So, ideally we should be having, say, 5 grams, or maybe you can go up to 6 or 7 grams a day. But here we almost have 12 to 14 grams. And that, of course, affects, your health also. So on one side, you're trying to promote double fortified salt, telling people it's good for you. On the other side, you're also trying to tell people, please consume less salt, because that's adversely going to affect your health. So both the things are going simultaneously. For salt, of course, last year we had a wonderful challenge called the a low salt challenge, in which we were coming out with recipes in which how you can actually reduce the amount of salt by using condiments or spices or cooking methods and still have nutritious food. So that is on.
Yes, ma'am. Mr. Khanna, now my next question to you is that the overview for global demand for better nutrition is there. What is the vision statement that you're coming up with, Herbalife, sir?
Well, Nidhi ma'am, from an organizational perspective, we are very clear in our approach to nutrition. And we have a portfolio of high performance, science-based products which meet all the global benchmarks for safety and efficacy. In fact, our network of distributors leverage on what we call the distributor difference to make the nutrition experience very personal and relevant to the consumer. And we are also committed to nutrition advocacy and education by working with various stakeholders to eradicate global megatrend obesity and malnutrition. Well, we believe that it's our responsibility as a global nutrition company to ensure nutrition reaches all aspects of society, and especially to those who need it the most. In fact, in 2019, we started the Nutrition for Zero Hunger initiative. Now, this Zero Hunger is a global program that is dedicated to providing nutritious food and nutrition education to communities around the world. The effort that is aligned with the United Nations Sustainable Development Goal number 2, which seeks to end hunger in all forms by 2030. Well, I'm happy to share that in India, Nutrition for Zero Hunger has impacted more than 5 lakh women and children to improve their nutrition choices and outcomes. And since March 2021, our distributors and employees of Herbalife Nutrition in India have contributed more than 1 lakh kilos of food that has fed more thousands of people and their families all across the country, in India.
Absolutely. And I think all our panelists will agree with this, that this kind of partnership that you are going through is impacting all the movements in the states as well. Dr. Garg, my next question to you. If we talk of children and women, what are the, hazards that you see, and how do you feel this could be addressed perhaps in India? So,
is your question that specifically to women and children in terms of their nutritional requirements?
Yes, sir.
For women particularly, I mean, you all know that they require supplements, particularly iron, in their reproductive age groups. And I think it should be advisable that they actually check their hemoglobin levels, and if they're deficient in them, it is better to supplement iron in them. For children, again, I think it's the wholesome food that is required to meet their requirements of growth, and very important they eat enough calories during their childhood and adolescence. I'll stop here.
Absolutely, sir. जैसे आपने कहा, यहाँ मैं थोड़ा सा digress करना चाहूँगी. I'll ask Kinoshi ma'am to also comment on what you think these kind of partnerships, like we have one with Herbalife, Do you think it's important for corporates to come around and support this cause, ma'am?
Yes, definitely. Because you see, in today's world, where in fact the consumers are constantly, sort of bombarded with advertisements and displays everywhere around them, there is a certain responsibility in terms of, what you're providing to the ultimate consumer also. What's really, sometimes incredible is, we go to rural areas, we go to far-flung areas, and you find people don't really have food to eat, but they'll always have some packaged food to eat or some beverage in a bottle or a can to have. And how is that in fact possible? Because again, the systems which are in place, the funds which are available, and of course at the end of the day, profit is there, and it's actually important. I mean, everybody, even we are earning money at the end of the day, to eat. So if we want to eat something, and we have information that, okay, there is a choice between, say, two products and one is more healthier, I think that becomes really, truly important. And what I also believe is that our consumers are becoming extremely picky. They are becoming aware. In fact, at least in urban areas, we've seen a lot of people, especially after COVID, shifting to products which actually boost immunity, products which actually help you remain fit and healthy and provide you with all the nutrients which are necessary. So FPOs actually adopt this or try to make their products more healthy. I think in the long run, there will be a greater acceptability towards those products than products which are, just satisfying your palate for some time.
Absolutely. जैसे आपने कहा, सरकार क्या क्या कर सकती है, समाज को भी आगे आना पड़ेगा, और यहाँ मैं सराहना करूंगी हर्बल लाइफ के इनिशिएटिव की। और अगला सवाल मैं लेती हूँ आपसे।
Can I just make a point?
Yes, sir.
So I think we have to break this myth of some dietary components boosting your immunity. And I'm not happy about that campaign, kind of dietary things boosting immunity. I think a well balanced, nutritious diet is what is important, rather than saying this particular thing will boost your immunity, prevent from corona, or prevent from other diseases and whatnot. So I think that myth has to be broken. Eating healthy means you're cooking your food at home properly, you mixing your food well, and I have given you the components that everybody can eat at home at a very, very reasonable price. So that is what is important, rather than, promoting something which is out of reach for large majority of our people.
बिल्कुल। गोहिल सर, यहाँ आपसे जानना चाहूंगी गुजरात के इनिशिएटिव के बारे में, टू इम्प्रूव द लिविंग स्टैंडर्ड्स ऑफ पीपल। कुछ नए खास इनिशिएटिव्स हुए तो उनके बारे में प्लीज जानकारी दें।
सर, मैडम, आपका क्वेश्चन बहुत सही है। I can happy to share that before Food Safety and Standard Act, जब 5 अगस्त 2011 में फूड सेफ्टी एक्ट आया, उससे पहले हमने December 2010 में we have started on this, because we know people are taking more food from the street than the restaurant and star hotels. So if we will start these practices from the street level vendors, and we are improving the manufacturing and processing methods of that particular food business operator. Suppose we think that एक food business operator है, उसकी जब हम change करते हैं उसकी methods, तो वो उसके पास जितने भी customer आते हैं उसको they will get the good food, and food is directly connected with the health. So on that basis we are doing from the ground level, and we are happy to share with some figures that Gujarat is leading state with the 28 districts we are participating in Eat Right challenges, and more than 58 Eat Right campuses are certified by this state government. Then 20 states are engaged with the Clean Street Food Hub, and more than, और यहाँ मंदिर में प्रसाद का भी ज्यादा रहता है, तो under the Bhog scheme of the FSSAI, we are also considering this, and basically our food enforcement team जब भी कोई भी कहाँ भी मुलाकात लेती है, with the ideas of the FSSAI, we are only concentrating the cook कि आप अपनी प्रोसेस किस तरह से करेंगे तो न्यूट्रिशन ज्यादा बचेगा और that will directly connected with the consumer. So we are doing this initiative regarding this, and we are also following the INNOCM's ideas from there, providing each and every time. So we are doing that.
एब्सोल्युटली सर। यहाँ मैं जानना चाहूंगी आपसे लीलावती मैम, अगर आप बात करें प्रिवेंटिव एंड प्रोमोटिव हेल्थ की या स्वच्छ भारत अभियान की, बैलेंस डाइट की, तो किस तरह के इनिशिएटिव कर्नाटका में लिए गए हैं?
As far as Swachh Bharat is concerned, they are promoting that a lot of toilets has to be constructed in the rural Karnataka as far as is concerned. And also we are teaching in our schools regarding the hand wash to the children. All the school children, and especially first to third, they are taught how they have to clean their hands. So such things we are introducing, and also we are telling them how they have to maintain their personal hygiene also. And the other thing which I came to know is that regarding women and children, regarding their nutrition, we have special programs for women, especially pregnant women, and also for the children who are studying in Anganwadis. And as I already said that these programs are monitored by our Chief Secretary himself, and usually he sees that the progress is in line actually. And in Karnataka, so Swachh Bharat health programs and environmental programs and these food programs are integrated and they are related to each other. And then even women and child department people, usually whatever food they provide to their Anganwadis Pushti are ICPS department people, integrated child protection scheme people. They have their own homes called Makkala Palana Kendra, where they cook food for the children. Those things are also monitored by our food safety people. So, and even AMF, Karnataka Milk Federation people, they also take our help to see that their milk or butter, whatever milk products they produce, usually they are intact. So like this, we usually monitor wherever, even our food and civil supply people also take our help to see that in the fair price shops, whatever food grains are provided, they are up to the mark. So like this, we coordinate with for food and civil supply, women and child, and all the other health departments also.
Absolutely, ma'am. Dr. Iram Rao, I would like to now ask you, what are your insights into nutritional self-reliance when we look at India at 75? Whether it's food technology, whether it's innovation, what would you like to speak about?
I think the big change which will make a change in our country would be, as everybody's mentioned, nutrition, health, and wellness. It's a complete package where we're talking about providing. If you talk about from the food technology perspective, I think the stakeholders, our industry partners, have to be responsible in delivering food which is just not tasty, palatable, attractively packaged, but also delivering nutrients, not particularly macronutrients, focusing on the micronutrients, talking about the bioavailability as it's been mentioned earlier, and also talking about that it should be still tasty, healthy, and palatable. So that's the big game changer which I see. And nutrition is going to make all the difference, as mentioned by our other colleagues also over here, that we do not want any expensive food. Food has to be wholesome. Food has to be balanced. Food has to be sustainable. The key words are go in for seasonal, in moderation, regionally available foods. We're not asking you to shun the foods which are expensive. Do enjoy them once in a way, but please do think of the poor farmer as well, that where this particular purchase is going to take, and also keeping in mind the carbon credits, And the final word would be that, we all as stakeholders have to start demanding for healthy foods, which are low in fat, or at least healthy fats they're giving us. They're giving you just the right amount of salt, which is required for giving palatability to the food. And also please go slow on the sugar. So if this is the kind of change, the industry is going to be under huge pressure to deliver this. And as Dr. Garg mentioned, nobody will have to resort to any multivitamins, any kind of thing. So if you're healthy, you can bank on this food. And finally, do not forget your water intake, and please change your lifestyle. It has to be healthy. Move out, stop using remotes, go out and break the shell of the sedentary life. And I think this would be a huge game changer for our country, which is at the ripe age of 75 years. Thank you.
Yes, very well said. One question that comes to my mind, and I'll ask you for this, Mr. Ajay Khanna, how does one bridge the communication gap, say, between consumers and provide a resource hub for them to stay aware and updated about food key activities?
Well, I think the speakers who spoke just now, they spoke a lot about educating healthy, active lifestyle. And I believe that the government of India and FSSAI have made excellent efforts to build resources to empower and educate people about food activities and food choices. The Eat Right movement, for example, is one of the most I would say the most powerful resource hubs for public health, and that has been validated by many credible stakeholders along with the FOSTAC. And also FSSAI has both revolutionized and institutionalized the food system, from formulating new regulations to capacity building via rating programs, Eat Right campus, Bhog, clean street food hubs, clean fruits and vegetable markets, clustering and benchmarking of street food vendors, to working with stakeholders to create safe and sustainable packaging material. I mean, FSSAI has built a strong resource hub, which we strongly believe that will enable widespread social and behavioral change in India, towards healthy and sustainable eating habits. And we as Herbalife, through our personalized approach to nutrition, we are uniquely positioned to support FSSAI in its effort to empower individuals and communities at grassroots levels with resources and education to make healthier choices.
Absolutely. Enoshi ji, यहाँ मैं आपसे जानना चाहूंगी, आजादी का अमृत महोत्सव चल रहा है. So how do you think policymakers could recognize and address the significant risk associated with chronically underfunded research in food, ma'am? Your take on that. What is FSSAI's call to action?
Actually, for underfunded research, I mean, it's really amazing that you've just raised it, because we recently, launched an Eat Right research award challenge where we actually want, now of course it's closed, but the purpose of this particular challenge was to recognize efforts which are being made all over the country, again in the field of, say, food safety, in terms of promoting healthy diets and, sustainable ways of production. So if anybody's done research in it, it could be an individual, an educational institution, or even a startup. They could apply, and we are ready to provide some sort of funding for a period of 1.5 to 2 years, in which, we can come up with some technological breakthrough or already a practice which is available in the country. What's amazing is in our country, we have so much knowledge, so much information. It's all there. But sometimes it's more regional or localized. It could also be because, there are certain food items or plants or vegetation which is particular to an area. And therefore, it could not have traveled to other places. But again, in today's world, when you can order everything at home online and everybody's trying out new things, especially with the lockdown, everybody's been experimenting. We've seen an amazing surge in terms of research for traditional indigenous food items such as millets. People had stopped having millets, but again, people are shifting over. So there's a lot of research which is there. A lot of research needs to be done also. It's not like it's always very easily available. So FSSAI does promote it, and we always encourage food businesses, research organizations to come forward, let us know what is new that they are doing, and we do support that.
Yes, ma'am. Dr. Garg, I'd like to now ask you, आजकल एक word बहुत सुनने में आ रहा है, immunocompromised. तो ऐसे लोगों के लिए क्या आप हिदायत देंगे, क्या कहना चाहेंगे उन लोगों को? Now again we're hearing of another variant in France, IHU. This morning it was all across the news. तो ऐसे में जो comorbidities वाले patients हैं, वो काफी अपने आप को परेशान नजर आते हुए दिखाई दे रहे हैं. तो उनके लिए क्या मैसेज देना चाहेंगे, वो कैसे अपनी इम्यूनिटी का ध्यान रखें सर?
देखिए, दो बातें हैं. when you say immunocompromised, we should understand what do we mean by this. So immunocompromised means your immune system, your defense system is not functioning optimally or properly. There are many reasons for that. One is related to your diet. That means someone who is malnourished, undernourished, does not or may not have adequate defense system. That is one part. And that's where the importance of food lies, that the person should take adequate, nutritious diet. The second is someone has an illness which puts the person at risk of being immunocompromised, means the defense system is down. So for example, someone who has got a cancer, then a person is immunocompromised. The third category is when a person is having an illness for which a treatment is being given, which compromises the immune function. For example, someone has a disease requiring steroids or some other drugs which can put a person at risk of developing opportunistic infection because of the defense mechanism being impaired. So when you talk about immunocompromise, it's a very, it's an umbrella term. But in terms of the food, when you talk about diet, it is the malnourished people who should be careful with their diet, because undernutrition or malnutrition does put them at risk of developing various infections. For example, tuberculosis is fairly common in those who have, malnutrition.
Absolutely. और या मैं गोहिल जी आपसे जानना चाहूंगी, कोई विजन स्टेटमेंट अगर आपकी है ऑन हेल्थ एंड न्यूट्रिशन फॉर गुजरात, प्लीज शेयर करें.
So as I have talked earlier, that we are going to do the work at ground level only. So वहां से ground से village area से जो भी काम होता है, please, are you getting me? I'm audible?
Yes.
Yes. तो वहां हम FSW फूड सेफ्टी की जो गाइडलाइन है उसका हम जो गुजराती में कन्वर्जन करके लोकल लैंग्वेज में तो हर विलेज तक जाते हैं. वहां हम ऑडियो में जो FSW के मीडियम से वो हम कर सकते हैं और वी आर प्रोवाइडिंग दैट टू द एट विलेज लेवल कंज्यूमर. तो ये करते हैं. तो फॉर ईटिंग वेल स्कूल में भी जाते हैं और स्कूल में भी इस तरह से प्रोग्राम करते हैं और उसकी बाय द मीडियम ऑफ द FSW एंड FSSAI guideline we are following that.
Absolutely. And in the end, I'd like to thank all the panelists for joining us and sharing your valuable time with us. Our focus today, friends, was to promote and safeguard public health by clearing doubts, confusion, and myths related to food and business and traders, users, anybody associated with the food industry, directly or indirectly. So let food be our medicine. Let us begin to strengthen our immunity. And remember, every machine or system needs a break. Our digestive system and body also need a break to detoxify itself. After all, health is wealth, and it is indeed the need of the hour to invest in the same and safeguard the future. I'd like to thank Mitro App, who worked relentlessly to create this one-of-a-kind digital event and brought all of you together on the same platform. I also thank Daily Hunt. A special shout out to FSSAI, Eat Right Foundation, and Herbalife Nutrition for thanking. And I'd like to thank you, Herbalife Nutrition, for supporting us in this endeavor. Many thanks to all the panelists. Namaskar.